Hi, my name is Joanna Thompson. I work on the Brixton Reel project. For the past 11 years, we've been focused on promoting mental well-being in diverse communities. Today, we're hosting a panel discussion called Surviving and Thriving Post-Coronavirus. I'd like to introduce our chair, Dr. Rua Omar.
Thank you, Joe, and huge thanks to the Brixton Reel for arranging this panel discussion and Q&A session for the Black community on a very important topic at the moment surrounding coronavirus and what it means for the Black community. My name is Rua. I'm a public health doctor based here in London. I'm here on a non-professional capacity today, and I will be your chair. We'll just start off by going through the panelists, and if everybody could introduce themselves, tell us a bit about what you do, where you work, and what capacity you're joining this conversation in today. So if I start with Leah.
Hi there, Rua, and hi everyone. My name's Leah D'Souza Thomas. I'm a public health epidemiologist. I have a background in biomedical sciences, and I've kind of worked in public health from a national, local and regional perspective for the last, let's say, 16 years, I think it is. I have recently started a health improvement practice called the Thrive Practice, where I support clients to get to the root cause of their illness. And my interests really lie in health inequalities, long-term health conditions and prevention, really.
Thank you, Leah. Ashley?
Good afternoon, my name's Ashley. I'm from London, I'm 25 years old. I run a mental health platform via social media, via Instagram, where I share my story to thousands of people, and I try and inspire people to feel confident about having mental health because it's something normal and it's nothing different, and I use that to try and inspire other people.
Thank you, Ashley. Hi, Jackie.
So my name is Jackie Dyer. I'm a lived expert by experience and a carer. I'm also the co-founder and chair of Black Thrive in Lambeth, which is a partnership that seeks to take a systematic approach to dealing with deeply systemic issues of racism and inequities within the system that lead to differential outcomes in terms of mental health. And I'm also the National NHS Mental Health Equalities Advisor, and within that, taking a cross-sectoral strategy approach to attend to the same issues around the protected characteristics.
Thank you, Jackie. Hi, Michael.
Right. My name is Michael. I'm currently a member of Mosaic Clubhouse, and I'm also a peer support worker for the outreach program operated here from Mosaic Clubhouse.
Lovely. Thank you, Michael. Hi, Beverly.
Hi, my name is Beverly Randall. I'm Programme Manager of Mosaic Clubhouse. I've worked at the Clubhouse for 17 years. We're based in Brixton, so we have quite a high population of ethnic minorities, Black people. I work with Michael. Michael goes into the hospitals, and although we're in lockdown, we're still in contact with people that have been discharged from hospital, and we're still sort of doing our bit. You know, and I think what I'm hoping to bring to this is to demonstrate that we are still working and we are still doing good things. It's not all negative.
Thank you, Beverly. That's fantastic. So if we can start off by talking about the general experience of the Black community throughout lockdown. Obviously, the lockdown has had a significant impact across the board on everyone's lives. But if we were to focus within the Black community, I wondered if you could all draw upon your own experiences or the experiences of your community and tell our viewers what the lockdown experience has been like.
The lockdown experience for me personally, it's had its challenges, but I've been coming to work. So, you know, it's not as bad, but I'm going to work. It's definitely shown me how people are struggling, especially the people in the Black community, because social media at the moment they're sending around so many WhatsApps, and you know, when I'm doing calls, because we're working remotely and we're calling members from our houses, and you know, I'm recognizing that a lot of the members are quite fearful because of, you know, information that they've been sent that's not factual information. So a lot of our staff team has taken up a lot of time talking to people, trying to help them to feel safe, because some of the Black members are thinking that, you know, the government are killing them, especially when you hear the higher percentage of people that are getting coronavirus is Black people. And, you know, and there's no real answer for that at the moment, but we're here trying to sort of like encourage people to help them so that they will, you know, be able to get up and give them a purpose so that, you know, they'll be able to survive another day, really.
You've touched on some really important points there, Beverly, and I think I've jotted them down so we can further dissect them. There's some, I think we need to expand on a few of those, particularly issues around misinformation and quote unquote fake news. But with regard, I suppose, to this particular question, are you able to share your own experience or your experience within your own community of how you've managed to take care of your own health and your mental health throughout lockdown?
So for my own health, when the lockdown began, I started walking. So even though I'm at work, I got my phone and I plugged in my earphones, and I would make calls to members, but I would walk while I was doing it. And I found that really helpful. You know, I'm not a person that would exercise, but I found that if I didn't go for those walks, I'd wake up the next day and I'd sort of be like, there's something wrong. I'm starting to feel heavy. But as the time went on, you know, I found that I was getting sort of caught up with, you know, everything that was going on. So I had to go back to bases and remember when I used to feel really well and link it to the fact that I walked. So I had to start doing that again. So I really think that what's helped me is exercising, really.
Brilliant. I wondered if anybody else had any views around exercise or other kind of coping strategies that they've employed in caring for themselves during lockdown. Jackie?
Excellent. I smile because that's perhaps the only thing that's really helped during this time is really being committed to physical exercise. So I've been very poor over the past couple of weeks due to the death of my brother a couple of weeks ago, last week. And I've been doing cycling indoors and workouts on YouTube, and that you have quite a variety, and I do that in my living room. But I haven't been doing that of late, so I'm a bit disappointed with myself, because what I found is that I felt that I've been working even more so than even when we've been moving physically about, simply because you end up being on a Zoom meeting or a Microsoft Teams meeting from dawn till dusk, and you're sitting sort of in your chair and having these meetings without the little breaks that you become accustomed to when you walk between meetings or travel from one part of London to another, or one meeting room to another within the town hall, for example. Yeah. So exercise has been a really good source of support for my mental health.
Absolutely. And Jackie, also, I'm very sorry to hear about your brother, and I'm sorry for your loss. And really, I suppose an important point there is that sometimes what you need to do to take care of yourself is a little bit different to the sort of mainstream exercise, improve your diet. Sometimes you just need to give yourself time to grieve, or be it to feel something. And so I think maybe moving on from that, what would your view, and I'll open this to the floor, what is your view for people who haven't really had the same access to, for instance, outdoor space or recreation space, parks, local parks, people who live in densely populated urban areas, who may not have felt safe or even able to walk around their neighborhoods during lockdown? What have you come across people like that within your own communities, and what kind of advice would you offer someone who says, I'm not able to exercise, and therefore as a consequence their mental health may suffer?
Well, since the lockdown, I've got some mobility problems here at the moment, so I can't really exercise myself You know, I can't go running and things like that. So I tidy up a lot. I wash up a lot. I've tried to do a bit of painting. I put up a few shelves in my home. So that I can't really physically exercise myself. So what I do for my mental state, I drive at night time. You know, I go for drives. So like, it's like therapeutic to me. You know, for my mental, for my mind, I drive about and, you know, and look at the world going by. And also I phone a lot of people, you know, I phone some of the members.
I think it's quite difficult, that it's actually been quite difficult for those who are sort of in environments where they don't have access to a garden or in flats. I'm in a flat and I know that it's actually, I'm lucky to have quite a big flat, but actually sometimes I get sort of suffocated by my own space. And so I can imagine that that claustrophobic feeling can be really quite difficult, especially if you've got quite a lot of people around you. So it's quite important for people in those sort of situations to really try and find space within the space, and just bear in mind that that is challenging, but that's also really, really good for your mental health. Sometimes what I've encouraged people to do is to sort of find a corner and read a book, or have your headphones in, listen to a book, or because not everybody's got access to the internet or all these kind of digital technologies that mean that you can stay connected with people beyond even your own environment. And actually the people that you've got within that environment is who you're connecting with 24/7. But it's also an opportunity to use that constructively, to have conversations within that environment that you wouldn't otherwise have about your mental health, your emotional well-being, etc. And that's something that we really need to encourage. And I noticed that in some of the families that I'm engaging with, that they are having some of those conversations that they wouldn't otherwise talk about, because a lot of the time you're being really distracted by everything and nothing. And in a way, in some ways, some of the positive benefits to lockdown is bringing families closer together. Of course, there are other situations where the dynamics make it even more worse, and that's another story. But there are some benefits. And what I do notice as well is that people are trying to get exercise. I noticed when I was in Huddersfield just now, just come back, that people are doing their daily walks, and even on the road where I live in Streatham, people of all generations are trying to get out and do the daily walks, because they're kind of becoming more aware that that physical health part of looking after their mental health is really important.
So we've seen on the news and within various bits of data that have been published so far that the BAME community, in particular the Black community, is more affected by coronavirus. That is to say that there is a higher rate of infection and a higher mortality rate within the Black community. And so I wondered if you could tell me what that means for you and for the Black community at large. So for example, we hear that Black men are up to 4 times more likely to contract coronavirus than the general population. What will that mean for a Black man going out into the world after lockdown is eased, looking for employment, looking for housing opportunities? And also that Black people are dying or are more likely to die from COVID-19. What does that mean for our community? We know, for instance, that there are frontline roles that are where Black people are overrepresented or highly represented. And so therefore, the more contact that you have with the general public, the more likely you are to contract coronavirus. But beyond that, did anybody have any experiences personally or within their communities that they'd like to share about that?
Initially, I thought there was like a sense of vulnerability, you know, being Black. You know, you hear about the things like prostate cancer, Black men are a lot more likely to get it. And then you hear about coronavirus, the mortality rate being so high for those people of color. And that made me feel slightly anxious because, you know, I've got my grandma, she's elderly, she's of a Black origin, and it can make you panic. But I just wonder if there's going to be something in play where when people go back to work and the quarantine is lifted and the lockdown is lifted, if that's what you want to call it, if there will be maybe a priority for Black people to get vaccinated or Asian people to get vaccinated, or if there will be like priority testing in workplaces for those people of colour. Those are the sort of things I'm questioning. Okay.
And Jackie, can I pull you in here? What are your thoughts around this? What does it mean for Black people that they are more likely to contract coronavirus and more likely to die from coronavirus?
I think, as Ashley has just said, it's like being where there are vulnerabilities, applying appropriate risk assessments and risk management, which is what Ashley's speaking to. So I concur with that. And actually, from NHS England, there was a requirement a few weeks back that all NHS services and social care services should be putting into place risk assessments that cater for the fact that Black, Asian and minority ethnic communities are disproportionately affected by the virus. That what's really interesting is how long or how difficult that is to put into practice, in the sense that some parts of the system seem to be quite resistant to doing that, even though the outcomes are of that nature. And that for me speaks to some of the systemic racism that we have to contend with in order to raise the level of protection in relation to our needs. But these are some of the challenges that are around that are urgent to be addressed. And because the reality of the experience is that it just exposes that which is already sort of present, and that's the challenge. Yeah.
Leah, can I ask you what you think it might mean for the Black community going back into the world after lockdown, being sort of branded as, amongst other BAME communities, to be more likely to contract coronavirus, to be more likely to die from coronavirus? Do you think that will have any kind of consequences for the Black community?
I think it undoubtedly will. The feelings of anxiety, concern, worry for family and loved ones, and I guess the element of racism and structural inequality that perpetuates this and ensures that people may not feel able or probably able or accepting enough maybe that they can speak up to their employer and say, I need to have X, Y, and Z in place in order for me to be able to come back to work and work effectively for you. Because it's very clear to anyone who can see, anyone with an eye, we can see that Black people are dying at a much faster rate, and we need the protection in place to ensure that if we are going to work and we are going out there, that we are protected and safe in what we are doing.
Thank you, Leah.
The Black frontline staff are not getting the acclaim that is due to them, you know, that they've been like forgotten about, really. Because when you see on the media, when they're talking about all these nurses and things like that, you know, we don't really see a lot of Black frontline staff on, you know, like on their mainstream media. So there's a lot of talk like that.
With regard to there being higher rates of COVID-19 mortality in the Black community and a higher possibility of contracting the infection, it is clearly understandable that this may cause some fear within the community. On top of this, there has been some misinformation circulating within the community as well. How can we reduce this fear, or how can we address it within the Black community?
So one of the things that I think we should do is stop. When you get a WhatsApp, stop sharing it. You know, it has its challenges even in where I live, because in my own home, there's people in there that have different opinions, you know, and I've decided that I'm not going to be looking at things that people are sending me that are not correct, but people are still passing it on. And if you pass it on, it makes you just as bad as the person that is sending it, you know, because you just, like, people that have mental health, you know, they have an element of paranoia. Some have that element. And if you send information around that's not true, I find that people believe it, and it's not harmless. You know, we've all got a responsibility to not do that. You know, it's people might look at it and think, oh, well, it's only a WhatsApp, but it may just be a WhatsApp to you, but to someone who's at home on their own, you know, that has no support, that can make them really frightened. I mean, in our community, one of our members passed away a week after we closed. And I can remember him coming in to work, and I said, look, you really shouldn't be here because you're one of the high risk people. And he was like, I'm really hungry. I've just come for some food. So I said, hold on, let me just get you some. So I put his food in the bag and off he went. By Wednesday, he had died because I was trying to say to him, follow the guidelines, please follow that. You have got underlying health conditions. And he was just so adamant that it wasn't true, this wasn't happening. And I got the biggest shock. He died, you know?
Yeah.
So it's just, we just have to be so careful what we're saying.
Absolutely. And just picking off of that point about the guidelines, how do people feel about the guidance that exists at the moment from various authorities? Do you think that it is accessible to the BAME, to the Black community in particular? And what is a way that you think might be, for instance, if you don't think that it is entirely appropriate, what is a way that you think might be more appropriate for a better reach within the Black community? So this is guidance around the social distancing measures, the kind of hand hygiene measures, the new guidance that is updated daily, essentially. Leah, can I bring you in here?
Yes, of course. I suppose I'm part of the system that creates some of that guidance, so it's a little bit wrong for me to say that it's not accessible, but I do understand that it isn't always as easily understandable, or I think we've seen quite clearly on the press briefings how guidance can be interpreted very differently by people. And the guidance that I know that PHE, for instance, Public Health England produces, that also can be interpreted quite differently for people. I think we need, it's an obligation for government and any organisation that is putting out guidance to ensure that it comes out in a way that people understand, it's accessible to each and every individual who it needs to go to, whether that be languages, or whether that be in the tone and tonality in which people are speaking, or in the same medium that people use a lot of the time. So whether, you know, WhatsApp or, you know, other means as well, it needs to reach people where they are. And I think we have been a bit remiss sometimes in terms of public health bodies in making sure that that happens.
Thank you, Leah. If I could please, oh, was that someone trying to say something?
Yeah, I was going to say something. I think that providing alternative messaging is really critical in languages that diverse communities engage with, and the mediums that they engage with, which is the sort of latter point. But I think actually even the construction of those messages needs to be done by those people who understand what is receivable by those communities, because actually the fear piece that we're speaking about earlier is very understandable. If you're in a society, as we've noted from the whole worldwide response and resonance with many Black communities across the world, and you're in a society that's dealing with systemic racism, actually your whole experience is about that kind of surveillance, that kind of systematic racism on a day-to-day basis, the stop and search, the differential treatment in many public sectors, be that housing, be that employment, be that in education, be that in health. And so actually some of those fears are based on a reality, and we don't want to be thinking here that people's fears are based on an unreality, because actually it's them making sense of the oppression that they're experiencing on a day-to-day basis. So I think that that's really important to understand. That said, some of the manifestations of some of these messages that are going around actually can be challenged by providing alternative ways of understanding the experience, and that's the kind of messaging that needs to be developed. And we're actually doing some of that work within Lambeth, where we're working with the communications via Black Thrive to actually really look more closely at what kind of messages that we're sending out to people. And there was a really good little pocket of good work that was taking place in my portfolio amongst youth offending services and the clients that use that service, whereby day in, day out, they're getting all these conspiracy theories and other messages, and really believing them. And what the workforce did was immediately find information that would challenge that would help them to see that differently and have those conversations immediately, which helped to kind of help people move towards a more fact kind of based kind of like thinking. Not to say that all the facts that emanate from public health, for example, is gospel. It might not be, because even as we can see with the COVID, there are differences in how all the scientists are viewing when we should lock down, if we should lock down, where if the virus is rising or not, whether we should, you know. So actually, people's suspicion, and suspicions is the wrong word. Curiosity and wariness is appropriate, but we can use that as an avenue to have better, thoughtful conversations, I would say.
I'm just going to shift the focus of the conversation slightly. I wanted to speak specifically about mental health. How have you accessed services, if you felt that you've needed them, in the last few months when we've been in lockdown? We know that a lot of services have had to shut down or switch to remote working. And so what is out there, what is available to the Black community in terms of mental health support?
Our services, Mosaic, it's open. It's open remotely, but it's doing exactly what we used to do when we were here. So we're using Zoom for unit meetings, which we have twice a day. Our building is actually being used by street kitchens as we speak, because a lot of the people that have been homeless, as you know, the government have said everyone has to be housed. So people have been housed in hotels, etc. So now, they're using our kitchen, which is great, and it's given work to our members, because we've got our own van, which we wasn't using at the moment. And one of our members he was like, I'm getting really fed up at home. There's nothing to do. For his mental well-being, he needs to be doing something. So Street Kitchens needed a delivery person, so he now works for them. So we've got a really good partnership now with Street Kitchen, because they're giving us food as well for our members. So members that couldn't go to the shops because they've got underlying health conditions, we're able to deliver them food. I know Lambeth is delivering food also, but it took a while for that to get going. So we're delivering food to people. People have still got their engagement workers, as we call them, support workers, and they're called daily. We've all been given phones so that if a member wants to call us directly, that can happen. So it's been really nice having Zoom as a tool, because today we had a meeting about how are we going to go back to work. So we're going to be open on July the 22nd, and we have the community on Zoom all talking about ideas, how we can open, what we're going to do.
That's absolutely fantastic, Beverly. And I just wondered, if someone was watching this, for example, and they felt as though they needed that support, that mental health support, how can someone engage with Mosaic?
So you would ring, if you rang Mosaic's phone, the phone service now will come directly to my phone. And we've also got an information hub, which is remote as well. So if people needed support with benefits, housing, anything like that, we can still do it.
Thank you. I'm going to now talk to Michael about what you were just saying about his experience. Michael, if I could get your views as a service user and the level of support that's been out there, how have you found it to seek when you've needed support? Have you found it easy to find that support?
Yeah, quite fine. Yeah, my care coordinator, he calls me Don. He calls me on a regular basis. We're on the phone sometimes for 2-3 hours, because we're near the same age. We come from the Caribbean, so we've got a lot in common. So we kind of support each other, really.
Fantastic.
Yeah.
Thank you.
Don, he's all right. He's a good man.
The Brixton Reel sent out an email to the mailing list that is used for events and for promotion. And we asked people within the Black community what their thoughts were surrounding coronavirus, but also in particular mental health and what it means for the Black community to come out of coronavirus. And we asked people if they had any questions or concerns. And some of those we've shared with you today. And one of them was surrounding caring for the vulnerable within the Black community. So in particular with the elderly in the community, there's been understandably a lot of fear within that particular sector within the Black community, and how older people feel less confident in coming back out into the big world and into kind of situations where they're interacting with lots of other people, and sometimes you can't quite avoid, say, certain situations that are a bit more crowded. If you're talking about using public transport, for example, and a lot of elderly people, because of mobility issues, don't really have the option of being able to walk or cycle, for example.
So one of the things that has been really wonderful is a massive surge in volunteers that has emerged, and that sort of capacity to support people, particularly our elder generation, I think can be really harnessed and used in a good way. And I want to go back to the previous point about mental health support in this time. I think that what is really critical to understand is that mental health, we all have mental health, and it operates across the spectrum. So we either have really poor mental health or we have good mental health. And actually within COVID, some of the impacts of COVID will have impacted people across that spectrum. And so what is needed in terms of support differs for people along that spectrum. And I think that then when you look at that in terms of psychological trauma or therapeutic support in relation to the Black community and their experience of disproportionate impacts in relation to COVID and the differential treatment that they've had, particularly in relation to the workforce, then what is required is a differential set of responses to attend to that. And I think there's no getting away from a reality that we have to have responses that attend to people's realities of discrimination and racism. And so what I often find is that there's a real desire to do something, but without doing the thing that is really the issue, or responding to the thing that's really the issue, or a significant part of the issue. And in fact, many people's mental health challenges have been as a result of people's discriminatory experiences in a cumulative way over many years. And that's further exacerbated by COVID. I think also we have to be aware of sort of the data and the intelligence around, if you look at the more severe end of the spectrum, people with severe and enduring mental health challenges, like my siblings, for example, that in London, for example, that Black people are more likely to be detained from their homes, not on the street using the Mental Health Act under Section 136, but actually where a warrant is taken out to take them out of their home. So one can imagine how, if that occurs without COVID, what might be occurring or bubbling up or taking place under the surface with COVID, therefore post-COVID. So I think it's really important to think about right across the kind of spectrum, and really be looking at a real different way of how do we support people. And one of the things that I'm wanting to push, and we are pushing for and co-creating that within Lambeth, is better human rights focus, better sort of advocacy, which is culturally appropriate, and peer support, which is culturally appropriate, so that actually people's differential needs and the realities of their experiences, which is not attended to by the mental health system, wherever you look nationally, is actually being catered for. That will also help us to attend to the post-COVID sort of implications right across the spectrum in terms of prevention, early intervention, and in terms of like crisis and community mental health services, but equally will help us to better attend to people when they're dealing with the impact of unemployment and lack of access to financial resources. We are now moving into a more intelligent way of sort of like supporting them.
Our current modelling predictions show that there may be a second wave of COVID-19 later this year. So of course, we would anticipate to see the same patterns in COVID mortality that we've seen amongst BAME groups this time around. So how can we as the Black community prepare for this possible second wave, and how can we build resilience in anticipation?
I'm going to be still, when I go out in the public, for months and months to come, I'm still going to be wearing my mask and using hand sanitizer and things like that anyway, you know. So I've been preparing my mind for that from a while back, you know.
Brilliant. Thank you, Michael. Leah, I wondered if you had anything else to add in terms of building resilience should there be a second wave?
Yeah, so in terms for me, the physical and the mental well-being is really key. Particularly the physical health. We know that the research shows that people who have got obesity or people who have specific underlying health conditions are at much greater risk for poor outcomes once if they do end up contracting it. So for me, making sure that those long-term health conditions are well controlled. You know, if they can't be well controlled, well, if they can be well controlled, that's great. Do what we can to make sure they are people are in a position where they don't struggle with these conditions, or they're not, you know, over exacerbated or reduced as much. For me also, I know it's difficult, but these are all diet and lifestyle related conditions, and if we really do focus on trying to improve both the diet and the lifestyle aspect, a lot of these conditions may not need to exist with people. I know that it is difficult, and I am speaking from a position where I mean, I was a diagnosed asthmatic, but I no longer use my inhaler. I've not used it since I had my last child, and I think she's now 11 years old, almost 12. So it is possible. There are things out there, things that people can do to ensure that they don't need to continue taking medication, for instance, for the rest of their lives. But obviously I do understand that there are people who are gonna need medication. So that's quite good in terms of physical health. I think in mental well-being, yeah, it's not great, but we do have to think that this may happen. I think being prepared as much as possible is really important. Financially preparing yourselves, making sure that you've got some money set aside. And yeah, in terms of transmission, to keep, you know, washing hands. For me, it's not just the sanitizer and the hand washing and the mask, it's about not touching your face as well, because that is so easy to do all the time. So it's about making sure you make that mind shift and keep your hands away from your face.
Absolutely, and that's a really important point actually, Leah, is that a lot of people are wearing gloves, disposable gloves, to sort of get about their day-to-day life, thinking that they will protect them. And while the gloves cover your hands, if you're then going around touching, you know, handrails and doing your shopping and touching everything in the environment and then touching your face, there really is no purpose to wearing those gloves. So more important than that is the frequent and kind of more prolonged hand washing and using alcohol and hand sanitizer. It does have to be at least 70% concentration, so making sure that you've got the right type. And also just maintaining that social distancing that we have been practicing. So the advice around how you can get tested should you develop COVID-19 symptoms. And at the moment, this is available through the government's home testing scheme. So if you search online for coronavirus home testing, this will take you through to the gov.uk website. The current guidance is that if you've had a fever, a consistent cough, or a new loss of the sense of smell or taste, you are eligible for a home test. You order this online and it is delivered to your home. And there are instructions on it of how to take the sample and how to arrange for a courier to come and collect it from you once you've taken the sample yourself. You don't need to go anywhere to send this test, and you don't need to go anywhere to collect it. again, a huge thanks to the Brixton Reel for organising this panel discussion. And for anyone who's interested in any of the resources or the mental health support contacts that we spoke of during this panel discussion, you can refer to the Brixton Reel website. We'll post a link on this, and within that there are various mental health services, contacts for various mental health services within Lambeth and London as a whole. And stay safe, everybody. Goodbye.